Thank you. The next question will be from Lisa McGinley to Heather Summers, and I will pass across the microphone. We're now sharing.
Thank you. We're changing gears here. The increasing number of deaths from abuse of heroin and opiate drugs is being called an epidemic. It clearly needs even more resources than it is getting, including coordination of law enforcement and healthcare systems. Do you have a plan for improving and expanding services, including prevention, and how would you pay for it?
Thank you for that question. Heroin is a crisis. It's a health crisis. I have been involved for over 2 years. I was one of the first people to found an organization called Shiloh, Shine a Light on Heroin, with Jim Spellman. We were at first called alarmists, but I actually lost a family member at 23 years old to an overdose of heroin during my lieutenant governor campaign. I never had any indication that anything was awry. So I am actively and intuitively and absolutely focused on this issue here. I think we need more access to rehab and medical resources. There's not enough mental health care doctors. There's not enough addiction doctors here in Connecticut. We are losing an entire generation of young people for this chronic disease. I think the legislature, it's the responsibility. This is one of the things that government needs to do with the healthcare crisis, and spend money to help save these young people, and to spread the awareness, and to do what we need to do, reduce the red tape. Try talking to any physician and see if they can get a mental health worker or someone into rehab. It simply cannot be done, and I would be absolutely willing to spend money on this crisis.
Thank you. And Mr. Bowles, the issue is the opioid crisis and what you might do about it as a legislator.
This is the kind of issue which is affecting the very soul of our communities. And this is one area that I would tend to differ somewhat with Mrs. Summers. We cannot look to the state of Connecticut to solve all our problems. We cannot look for state programs and agencies to come up with solutions to this very serious crisis that we have, not only here in the midst of this region, but also throughout this country. As a longtime behavioral health specialist, as a social worker for many years, I was first exposed to the whole concept of drug crisis back in the 80s with the crack cocaine issue, when I saw a spike in domestic violence. It is critical that we, and as suggested in the question, that we really develop prevention programs, early intervention programs, and yes, we also need to be able to develop rehab programs as well. But it's going to take a partnership. It's going to take, and if I may use a phrase that's been used before, it's going to take a village. It's going to take all of us together collectively. I happen to belong to a men's group up in my local church in Preston. We have taken on this issue collectively, and we understand, because this particular tragedy has impacted our church, has impacted our community. So I think we, again, collectively, together with the state, together with the church community, together with other folks that are invested in trying to come up with solutions on this, we need to work together to come up with the way we handle this.
Ms. Summers, you get another 30 seconds if you'd like to respond.
Absolutely. I think the state does have somewhat of an obligation to help. This is a healthcare crisis. I don't believe that the state should fund the entire thing, but I think they have a part to play. They have a part to play in helping get rid of the red tape. They have a part to play in helping municipalities afford Narcan for every single police officer, and I believe that Narcan should be in schools. They have a part to play in helping us develop a collaborative effort between law enforcement, physicians, rehab specialists, and our school systems. So I do think the state has a part to play, but I think this is a very important issue. Heroin knows no boundaries, no socioeconomic boundaries. It does not discriminate, and it comes in all shapes and sizes, and it can be a businessman or a young person. We have to hit this head on.
All right, thank you.